Hello, I'm a licensed massage therapist. My name is Chantel, and I'm here to teach you about the skeletal system, how they are shaped, and that is composed of bones, the functions and dysfunctions, and how to make the bones stronger. Bones are the structural foundation of our body. Bone tissue is highly dynamic, constantly changing from infancy to adulthood. In adults, we have 206 bones. In kids, we have 270, almost 300 before they solidify. The functions of our bones is to provide support so that we are able to stand, movement, protection. It protects major organs. It provides balance. It helps with blood cell formation, and it stores energy. There are different types of cartilages, 3 types of cartilages. The first cartilage will be the hyaline cartilage, which is the most common in the body. It is found in our ribs, nose, voice box, and windpipe. Fibrocartilage have thick collagen fibers, part of our bones that makes the most movements, which is the fibrocartilage can be found in our knees, wrists, ankle, intervertebral discs, our joints, and ligaments. Then we have elastic cartilage, which is found in the exterior ear and part of our voice box. The elastic cartilage is the least common type of cartilage found in the body. Then we have the classification of bone shapes. We have 4 different types of bone shapes: long bones, short bones, flat, and irregular bones. Our long bones consist of our legs and arms. The short bones are cube-like bones. They provide support and stability, even in the absence of motion, and allow movement of the limbs. It includes the wrist and the feet. Then you have the flat bones, which is plate-like bones. And these bones are found in the skull and ribs and sternum, and it's definitely used for protection. Then you have the irregular bones. These bones have complex shapes that do not fit in any of the categories that I just named. Irregular bones can be found in the face, inside the skull, the vertebrae, the sacrum, the coccyx, which is what people may refer to as the tailbone, the temporal, the syphenoid, ethmoid, zygomatic, the inferior nasal concha, which is part of the nose, the palatin and the palatin bone, which is the bone that separates the oral cavity from the nasal cavity, and it's flat, irregular, and it's a facial bone. And then you have the hyoid bone, which is in the throat. There are many conditions that can cause bone diseases. Some of them would include genetics, aging, hormonal changes, nutrition like vitamin D and calcium deficiency, environmental factors, exposure to cadmium, lead, mercury, pesticides, phthalates, and bisphenols. Sex in occupational risk, infection, injury or overuse, inflammatory arthritis, diabetes, smoking, heavy alcohol consumption, lack of activities, corticosteroid use, which treats asthma, allergies, eczema, hives, psoriasis, COPD, inflammatory bowel disease, multiple sclerosis, lupus, Addison's disease, and it may be used to treat people recovering from an organ or transplant. Now, that was the causes of bone diseases, but right now I'm going to talk to you about diseases and conditions of the bone. So we have fractures. A fracture is a broken bone. You have three types of fractures: simple fracture, incomplete fracture, and a compound fracture. A simple fracture has little to no damage occurred to the surrounding soft tissue. An incomplete fracture is a bone that is cracked but not completely broken. A compound fracture is the bone is completely broke and a great deal of soft tissue damage has occurred. Fractures become problematic when they affect the growth plate in children. When the bone fragments heal in the wrong position, or when the healing process is slowed down, or if a bone breaks multiple times. The healing of a fracture is due to age, nutrition, and unrelated stress factors or environmental factors. Another common bone condition is osteoporosis, a condition where calcium is pulled off the bones faster than it is replaced, leaving bones thin, brittle, and prone to injury. Sometimes a person suffering from this condition have more health conditions, especially the elderly. Then you have arthritis, referring to a disease state involving inflammation to the joint. When synovial linings become inflamed and the damaged painful problems can arise, these problems are referred to bursitis, tendinitis, and arthritis. Rheumatoid arthritis and osteoarthritis is the two most common type of arthritis. Tendinitis simply refers to any inflammation associated with a tendon. Joint injury, which can be a dislocation when the articulating bone of a joint are not in correct relationship and shared surfaces have become disconnected, usually because of trauma. Muscles that cross the affected joints may become hypertonic in an attempt to stabilize the nearby structures. It can lead to pain, trigger points, and a lack of full range of motion. Then you have ligament injuries, which are called sprains. Ligaments are non-contractile tissues, meaning they don't move, and they are typically damaged when they are stretched beyond their strength. Ligament injuries are graded like muscle injuries. You have grades 1, 2, 3 sprains. A grade 1 sprain is 0 to 20% tear collagen. Then the grade 2 sprain is 20% to 75% tear. And then the severe grade 3 sprain is more than 75% tear. Severe ligament injuries should be taken care of immediately, as they can tend to lead to major joint instabilities and malfunction. Things to do for muscle recovery and to strengthen your bones is eat a overall balanced diet, drink clean water, stretch, prepare for a good quality of sleep, receive massages, wear compression garments, do hydrotherapy, which is a great therapy for people that like to get in the pool or swim at the beach or lake. Cryotherapy, which is applying cooling pads, cooling down after a brisk walk, and myofascial release, which will be good for trigger points. Thanks for watching, and don't forget to subscribe, like, and share.